Well, thanks so much, Mags, and thanks for having me here today to be part of World Brain Day. And I can't think of a snappier title. Got stuck on brainy. Do you know what I mean? That's not great either. So, but it is fantastic to be here on World Brain Day and to have the opportunity to be here with so many elected colleagues. If I could just acknowledge them, obviously my excellent colleague, Minister Kieran O'Donnell, who's doing so much work both in the Department of Health and in the Department of Housing in relation to supporting older people. And we know where the demographic challenge is going in Ireland. We can see the trend. It's very, very positive to have a growing population, to have an ageing population. But boy, oh boy, do we have a challenge to make sure that we can support people to live well in their older age. And Minister O'Donnell is at the front of that in every respect and has done enormous work on dementia, has done enormous work in neurological conditions generally. But I just wanted to highlight his work in relation to supporting that and his dedicated focus as a Minister for State supporting older people. It's also fantastic to see my Oireachtas colleague, Colin Burke, who of course is the chair of the Oireachtas Neurology the Oireachtas Committee on Neurology, and I see Gillian O'Toole. It's fantastic to see you here also, and our wonderful MEP colleagues Billy Kelleher, our host today, and Nina Carberry, both on the MEP interest group on brain health and neurological conditions. And of course, I saw Billy, I think last week, or time goes by very quickly, possibly last week, possibly this week, in Brussels on the Sant Committee, where we started our European presidency dialogue with the Parliament to describe what Ireland's presidency priorities will be. But we'll come to that a little bit later. Thanks, Mags, for the warm welcome, and it's wonderful to see all our NAI colleagues whom we've met a number of different times. There's so many people in Ireland with an interest in, whether it's direct or whether it's a family connection, an interest, a personal interest in neurological conditions. We know so many people. My family, I really do want to acknowledge that I'm missing my colleague Patrick O'Donovan today, who I know would absolutely love to be here. I was chatting to him over the weekend, and he would very much like to be here. And it's also great to see our Chief Clinical Officer there sitting at the back of the room trying to hide, but very much here, and it's great to see him here today. Why? Because this matters for so very many people in Ireland and so very many people across Europe. And I'm so glad to have the opportunity to have this dedicated research and academic focus on it today that you have facilitated here, and crucially to do that in the European context as Billy has led to do that. And again, it's wonderful. I know you're going to have a video address from our colleague MEP Adam Jarubas, who's the chair of the Sant Committee of the Health Committee in the European Parliament, the Committee on Public Health, and his leadership is going to be really important in how we advance the dialogue at a European level on neurological conditions. It's also very good to see how Future Neuro, whom I have met differently, and the Centre for Translational Brain Science have brought together the programme along with Trinity College, Global Brain Health Institute, the European Brain Council, the European Federation of Neurological Associations, and the European Academy for Neurology. So if that isn't a list of serious people interested in improving the lives of people with neurological conditions, I don't know what is, and it's going to be an excellent conference today. I think if I could just say today's event is particularly timely this month. You know, you're here obviously at the invitation of our MEP colleagues in the European Parliament building. This event is not just World Brain Day, but it is the opening month of Ireland's presidency of the European Union. Such an important moment, such an important event. For those of you who haven't already been told, and you will be reminded many times in the next 6 months, this is our 8th time to hold the presidency of the Council of the European Union. It's a fantastic opportunity for Ireland as one of the strongest, most committed people to the values of the European Union, to the European Union, the country that comes consistently right at the top in terms of support for the European Union in the Eurobarometer analysis, to celebrate being European and to celebrate our contribution to Europe and our capacity to contribute to Europe, we believe very positively. To be a country that has been both a net recipient of European support, European financial support, and now a net contributor, and one of the highest net contributors on a per capita basis, I think is a real honour and a real measure of quite how far we have come as a country, quite how far we have come as a state, and how much we contribute to the European project and to European integration. And one of the ways that we do that best is, of course, through our experience and our expertise and our total commitment to public service, not just at national level, but at European level. And so there is an expectation, I'm sure Billy and Nina will agree, an expectation that the Irish presidency will be productive and will drive hard for the benefit of everybody in Europe. And I can assure you that certainly on the health side, our officials have started very well, have got many meetings for our working parties into the, right until the horrendous and offensive thing of doing it right at the end of July. So we are making people right across Europe work hard, and to do that, of course, for the benefit of patients. We have two really key files to drive at a European Council level and indeed at a Parliament level on a complementary basis. As Billy mentioned, the Medical Devices Regulation and the Biotech Act, the two big pieces of legislation that will, we genuinely believe, change the opportunity for patients and change the opportunity for industry in Europe to be able to bring innovation in the most simple way, to bring innovation from the university and the research lab to the patient much more quickly than is currently happening, without diversion to the United States, either in terms of looking for registration, for regulation, or indeed looking for finance, and to bringing the ideas that are being generated and fostered in Europe to the benefit of patients much more quickly than has been the case. So it's a fairly unique opportunity to progress something that's both an enabler for industry, much of which happily lives in Ireland and is supported by Irish people, Irish clinicians, Irish researchers, but for the benefit of patients as well. And we don't often get that happy confluence of events. And this presidency is a great opportunity to advance something really constructive and really positive. So I hope that by the end of the 6 months, you will be thoroughly sick of us telling you this or of us updating you on this, if you'll forgive me. But it is, we take it really seriously, and we want people to know what it is we're investing our time in on a European basis over the next number of months. And that really is it. Of course, we're doing this as an honest broker. We're not doing it on behalf of Ireland as such. We're doing it on behalf of all of the people of Europe. And what Billy said about the equality of access across Europe, the equality of access to the newborn infant, the infant screening tests and so on, is exactly right. You know, in Ireland, we're extending the number of conditions and have done over the last number of months, but we're nowhere near where we'd like to be. But what we really see across Europe is this need for health equity and the same access, whether it's the same access to pharmaceuticals, whether it's the same access to clinical trials, whether it's the same access to medicines. We are trying to flatten the curve of experience in healthcare, and it's a complicated thing to try to do, given that health isn't a national competency, that isn't a European competency and remains a domestic competency. So we really are trying to straddle the balance with, you know, how far we can push the boat between not changing the European treaties, which we don't enjoy, particularly in Ireland, and making sure that we can actually do the best collaborative work for the people of Europe. So that means, for example, with the Biotech Act, being able to collaborate on clinical trials, being able to find ways to pool our ability to purchase medicines rather than being against each other or bidding against each other in different ways. But we have to try to figure out how to do that, recognising the particular structures of the treaties, but the presidency, you know, is focused on those, you know, economic competitiveness, but the values and principles, which is what I'm saying, health equity and getting products to patients as quickly as possible. But today is different. Today is not obviously just about the presidency or anything like it. Health is first and foremost and only about people and how we support them and how we use research to support people, how we improve quality of life for patients. And today, especially, today is our focus on people with neurological conditions. We know, generally, we know from our own experience, from your professional expertise, we know that from the World Health Organization that neurological conditions are considered one of the leading causes of ill health and disability worldwide. We know that neurological conditions are the most common cause of disability and unfortunately premature death, and that the prevalence and impact is only going to increase given what I mentioned about our ageing demographic. In Ireland, of course, we believe 860,000 people living with a neurological condition, almost 1 in 6 people, and it is a huge personal and economic cost. The opportunity to work predictably, the opportunity to live life predictably, the opportunity to participate, the social and economic cost of neurological conditions is very, very significant. The impact on one's confidence, the impact on one's ability to participate, so many different parts of life are impacted by the unpredictability, I suppose, and the many aspects of neurological conditions, but one of those obviously is the unpredictability, and the impact on health and quality of life is to be acknowledged and remembered today for all of those people who aren't enjoying the same easy path as I am today, or as many other people happen to be. I think, as Billy mentioned, it is so important that we get to a point where we have an EU strategic framework in relation to this. We have taken so many steps together in Europe, whether it's bringing together our data, understanding our use of population data. We have taken steps in the past, as Billy has outlined, in relation to cancer. We're currently focusing on cardiovascular health across the EU. That is also a part of the European presidency. But where we have, conditions that impact so very many people across the Union, to the extent that we can collaborate and have a collective strategy on how we address and support people, it is really the only way of achieving real health equity and making sure that people in Bulgaria have the same opportunity as people in Germany, as the same opportunity as people in Ireland. But more than that, that we can harness the intelligence and the innovation and the experience of clinicians and researchers right across Europe for the benefit of everybody in Europe. So there is a huge opportunity to do this. We reached a major milestone in 2022 with the adoption of the World Health Organization Intersectoral Global Action Plan on Neurological Disorders and Epilepsy. And I know, building on that then, in the SOND committee, there have been recent hearings on neurological health, and now we have this commitment, I'm so glad, to examine the development of the European Neurological Health Strategy. So today, against that backdrop, today is a really important opportunity to contribute to that. Today is a really important opportunity to feed into that and to give direction to that, and it aligns very closely with what I said about our European presidency priorities generally. We domestically in Ireland, we are trying as well, of course, whatever about at the European level, of course, we have our own domestic needs to meet. This year, we committed to developing our next national stroke strategy following the conclusion of the current strategy in 2027. That, of course, will align very closely with the Stroke Action Plan in Europe, which I signed earlier in the year. We saw huge benefits from the existing stroke strategy. I mean, really significant benefits. And when you think now about what's possible in terms of the use of AI and all of the other pieces about how we can improve care, how we can improve the speed of care, so much more is possible and continues to be possible because of the developments in technology. And it's a very exciting opportunity to go again and go further. Of course, Ireland's participation in the Genome for Europe is another example of our commitment to trying to support European action in this area, and I think that will be a big resource to support research, to help us improve disease prediction, prevention, diagnosis, and of course we have to harness, and if we don't, it's nearly criminally irresponsible not to harness the benefits of the European health data space regulation and what's possible through that. And we have passed all of the relevant legislation domestically to enable us to do that. And there's a big opportunity for us to do that. But look, there's a fantastic opportunity here. We have, as you're well aware, world-class research institutions. We have multinational investment. We have the companies here who are investing in health technology for the future. We have a highly skilled and committed workforce. Ireland is really well positioned to accelerate the development of novel diagnostics, of therapeutics, and of digital health technologies for neurological disorders. One of the things that Minister O'Donnell and I are most proud of today is the advancement of the strategic plan for the development of healthcare in the Midwest. And while so much of that is focused on the development of an additional hospital and additional facilities, Minister O'Donnell and I see it very much as stating of putting down a mark for how ambitious we can be about combining health for patients and health for the economy through research. We have the opportunity in the Midwest. We have a new site where we can build a world-class hospital, a research institute where we can partner with the various life sciences, pharmaceutical, medical technology companies that all happen to be exactly there, where we have a university, where we have an existing hospital, and where we can design the partnership of health for patients and health for the economy and health for the future all together with a really ambitious plan, and that's what we want to try and deliver. And we have this thank you very much. And we have this opportunity which we are announcing today. So all of the time we're trying to think about the future, all of the time we're trying to think about it from the perspective of delivering for patients, which is really the only thing that matters. But because of the opportunity through the legislation, the competitiveness legislation in the European Union, we have this happy accident of being able to deliver so much more for researchers, so much more for those who want to take their research to market, but crucially to do it in Europe and to stop that drift to it going to other places patients, so that it's European patients getting it much more quickly and getting the benefit of that. So what you're saying today matters. It's important that you're feeding into this at this stage, that you're doing it here in Dublin. We're so delighted, and I want to commend the Neurological Alliance of Ireland and everybody here for your leadership in organising this. Thank you so much for the work you're doing, and I wish you well today.